Welcome, everybody. My name is Amanda Lewis, and I'm the director of the Institute for Research on Race and Public Policy here at the University of Illinois at Chicago, metaphorically here, of course. On behalf of UIC's Social Justice Initiative and the Institute for Research on Race and Public Policy, I want to welcome our panelists and everyone watching to today's event on imagining and demanding educational justice in the time of coronavirus. This is our third in a series of conversations that explore the social and racial inequities that have really been highlighted by this pandemic, and particularly what we need to be thinking about doing now to advance a more just and equitable future. Today, we are super excited to have this wonderful panel of scholars, educators, activists, and organizers in conversation about how we can understand the challenges we face currently with trying to ensure educational justice for young people in the city of Chicago. Moderating our panel today will be Dr. Eve Ewing. I should say, by the way, that this is such an esteemed group that I could take up the entire time with their bios, so I've shortened them all, but I want to at least let you know who they are. Dr. Ewing is a sociologist of education and writer from Chicago. She's the author of the poetry collection 1919 and Electric Arches, and the nonfiction work Ghosts in the Schoolyard, Racism and School Closings on Chicago's South Side. She's an assistant professor at the University of Chicago School of Social Service Administration. And these are in no particular order. Dr. Elizabeth Todd Breland is the author of A Political Education, Black Politics and Education Reform in Chicago since the 1960s, and an associate professor of history at UIC. She also organizes professional development workshops and develops curricula on African American history, urban education, and racial equity. Dr. Todd Breland is also a member of the Chicago Board of Education. Dr. David Stovall is a professor of Black Studies and Criminology, Law, and Justice at the University of Illinois at Chicago. His scholarship bridges critical race theory, the relationship between housing and education, and the intersection of race, place, and school. He works with community organizations and schools locally and nationally to address issues of equity, justice, and to abolish the school-to-prison pipeline. Dr. Cristina Pasiones-Zayas directs the Vision for Policy and Leadership initiatives at the Erickson Institute, a child development academic institute. She directs the Community Data Lab that seeks to democratize knowledge by curating timely and accessible child well-being data for local leaders. She also serves as board secretary on the Illinois State Board of Education and co-chairs the Puerto Rican Agenda of Chicago, a nonprofit organization of local Puerto Rican leaders who influence policy for the self-determination of Puerto Ricans. Dr. Monique Rideau-Smith is a youth, community, and union organizer who currently works as a professional issues director at the Illinois Federation of Teachers. She was a longtime middle school social studies teacher in CPS on the South and West Sides and has her doctorate in educational policy studies from UIC. In 2015, she participated in a 34-day hunger strike along with 11 other community members to save the last public open enrollment high school in the community of Bronzeville. Currently, she's also serving on the CTU CPS task force overseeing the Sustainable Community Schools Initiative. And finally, we have Dr. Marie Sweeney, currently serving as Chicago Public Schools' first Chief Equity Officer. Prior to this role, he served as the principal of Chicago's Tilden Community Career Center. In his new role with CPS, he's responsible for examining policies and programs for inequities in implementing strategies that minimize gaps in resources, staffing, and making sure we have high quality academic programming for all kids. You can see why we are super excited to have everybody here. Thanks everybody for joining us, and now we'll turn things over to Dr. Ewing. Thanks.
Thank you so much, Amanda, for having us, and thank you to some of my favorite people that I admire so much, and I'm excited to be in conversation with you all today. I want to share up front that I posted this conversation on Instagram and asked people to submit their questions, and so pretty much all of the questions that you'll be hearing today were submitted by people who are going to be in the audience. So really grateful that folks are very engaged in this conversation and really energized to think about what it means to fight for equity in this moment. So the title of the panel does two of my favorite things, which is imagining and demanding. And I thought we could begin there. There is lots to be sad about in this moment and lots to be uncertain about. But I wanted to start by asking each of you, what opportunities for educational justice are in front of our eyes right now that we might be missing completely? What are the opportunities for imagining and demanding that are presented by this moment? And I'll start with that for the group.
Well, Eve, again, thanks again for having everybody. I think something briefly in terms of imagining something different. I think now when we see the suspension of things like teacher certification programs like EdTPA and standardized testing, I think these two things are reminders of the unnecessary engagement of them in school spaces. So when we think about reimagining, two things that can be eliminated instantaneously would be standardized testing and teacher certification evaluations in this form known as the EdTPA, which is the Education Teacher Preparation Assessment. So those two things can be taken off the board instantaneously right now.
I would follow up on that. I am on the Sustainable Community School Task Force, and so I am using every opportunity and every platform I have to push for sustainable community schools and for funding and investment. I'll just give you briefly what the principles of sustainable community schools are, and then the pillars that we believe need to raise those things up. So the principles of the Sustainable Community School Initiative, which comes from the struggle of Black and Brown communities who have been fighting for educational justice for decades. These are the principles: racial justice and equity, transparency and trusting relationships, self-determination and governance, building on community strength and wisdom, shared leadership and collaboration, a reflective learning culture, and a whole child approach to education. Which one of those do we not need in this moment? Right? And so the educational activists and organizers have for decades, like I said, been pushing for this to be how we operate and work as a function of schools, right? And in this moment, we have an opportunity to do that. And so just building on what Dr. Stovall has already talked about, some of the pillars of that with the Sustainable Community School Initiative is the first two pillars are curricula that's engaging, culturally relevant, and challenging, and an emphasis on high quality teaching, not testing. That is what is engaging our young people in this moment. We don't need for them to be engaged in ACT prep right now. We need young people who are thinking about how our food deserts, how is institutional racism being exacerbated in this moment? What are the solutions to the issues that are now facing our community, that have been facing our communities? We have young people who are making PPE equipment for our folks who are on the front lines and using 3D printers in their CTE education. That is what education needs to look like. We need to be engaging in a curriculum that centers our young people, their experiences, and values the wisdom of the community. Because right now we're in a space where teachers absolutely are dependent upon parents and parents are dependent upon teachers. That's the way that the educational system should work anyway. But especially when it comes to curricula, we often isolate our families, our parents, and we don't think about the wisdom that they bring. And so in this moment where we are absolutely dependent on parents helping to facilitate the education of our young people, we need to make sure that we're thinking about that post-COVID and how do we continue that kind of engagement and that kind of parental participation.
Yeah, I'll hop in. Thanks again. Good to see everybody. What's coming up for me, I've been asking myself this question of going back to when I was in high school, we had multicultural education, and then it shifted to multiple intelligence, and then it went to cultural competence, and then it went to differentiation, and now it's at culturally sustaining and responsive pedagogy. And as I sort of hear and sort of see that playing out over the last 25 years, I'm asking myself of like, why have we not done the thing that we know we should have already been doing? And how do we stop sort of the name change, which sort of helps capitalists make their money, right, off of the newest products? But really, how do we make sure that we are doing the social political consciousness work that should be happening when we talk about all of those things? So we in CPS have created the CPS Equity Framework as a way of re-engineering the way we see school, which calls into account what are the conversations that we need to have that we're not having? Who has a seat at the table? Who has a sustainable seat at the table? Where do resources need to be? How do we also advocate for additional resources? And also, what policies benefit some people and burden others? So really sort of taking a more holistic approach in terms of like the infrastructure around equity, and also just pushing ourselves. You know, when we were able to give out technology, we learned very quickly that we were able to do the thing that I think has always been talked about, of closing the digital divide. So we started that process. And so what I'm thinking about now is, how do we sort of not revert back to where we were, but take this as this crisis as an opportunity to advance greater equity in the city, and doing that with people and not for people. I think that's a critical piece of this work as well.
Yeah, I'll just build upon what Maurice was saying on that last point in particular. I feel like in other things that have been lifted up, I think as well, but I think we're at a unique moment where there is, to your point, even opportunity to engage our communities in ways that we never have before, to trust and work with parents in ways that we never have before, to listen to our communities and learn from their wisdom, their collective wisdom. And I think it's a challenge to do. There are some clearly technical challenges to doing that right now, but to the point that was made, the collaboration that's happening right now between teachers and parents is something that we've never seen before in this way. And so I think that has to be nurtured and built upon moving forward on the backside of this. And I guess the other thing I would say, just sort of more broadly, I think this is a really important time on a policy level, at all levels, city, state, and federal, to fight for public education and to fight for greater, not lesser, funding for public education. As others have mentioned, the crisis that is upon us is, there have been crises. Crisis has been the state of affairs for years in our communities. And what this has done is show it maybe to some people who hadn't been aware, and exacerbate it for many people living in these conditions. So to think that in this moment, what's necessary is to peel back rather than to invest more, I think is a problematic way to think about this opportunity. And I think the other thing that really needs to be foregrounded for a broader audience is what public education and the role that public schools play in people's lives. Public schools have been a backstop right now in society, in a society where people are dying, where people are getting sick, where people are hungry, where people are losing their jobs. And all of those things, as we know, come to the door of the schoolhouse, and they're coming to the door of the schoolhouse in a way they never have before. CPS has given out over 10 million meals, right? Like, our communities have needs. Those needs existed before then. The needs have been exacerbated now. And I think I'm hoping that folks are having a greater appreciation for the role that public schools play in meeting needs that go far beyond teaching and learning and sort of academics. But the basic needs of communities are being met by schools and by educators, and that families are seeking out these spaces. And this is a time to really fight for public education and greater investment in public education.
Just to build on the concept of needs and addressing those needs, I would like to just add that we have an opportunity to really promote a culture of care and healing-centered engagement. Dr. Jen Wright talks about this specific kind of framework in his research, and I think more so than ever, you know, we have an opportunity to kind of reframe and reimagine our system. When the State Board of Education had its retreat back in September, I said, you know, how can we as a system start to think about operationalizing what Paulo Freire says, that education is an act of liberation and freedom. And therefore we should be putting systems and structures in place to decolonize and to unlearn all of the ways that we have been socialized to hate ourselves and to remove ourselves from our community in order to foster some type of success. And so I really think that, you know, schools right now have been operating as hubs or anchors for communities on basic needs. And I think we need to continue to build upon that. And also to you know, Dave's point about the profiteering that's happening, I think we need to be incredibly vigilant of what is called disaster capitalism, where you have profiting off of disasters and crises and ultimately unveil the intentions of the investors in our system. One of the things that I've really been pushing for at the State Board of Education is that any contract we award, I want a disclosure of where they are investing their dollars. If they're investing in prisons, private detention centers, harmful environmental factors, all of that contributes to what we're seeing right now play out. We need to have that as base for any kind of decisions that we're making, and not be investing in that with the public dollars we're entrusted to allocate.
Thank you all so much for that. And I just want to shout out, because I know we have diverse audiences that have different levels of familiarity with education policy and our jargon, that to remind folks that CTE, that Dr. Rideau mentioned, is career and technical education. And then Dr. Pasiona Zayas, you just mentioned a great book by Sean Ginwright, which is Hope and Healing in Urban Education, if folks want to go learn more about that. Elizabeth, you brought up, Dr. Todd Breland, you brought up something really important, which is the fact that this is all layered on top of existing inequalities. And I was wondering if, from a historical perspective, if you could put on that historian hat for a second and tell us about the things that have happened that lead us to this moment. What are the situations and the context that create the conditions for this crisis? Because we know that it doesn't just arrive out of a vacuum.
Sure. I mean, so it's been interesting to hear historians think about this particular moment and the COVID crisis. And I think there's been a general sort of hearkening back in some ways to like the flu of 1918 or other sort of more contemporary contexts. And I think for schools, that's not particularly helpful for a number of reasons. One, I mean, people weren't going to high school in 1918 in large numbers. So schooling was very different then. But I do think that, to the point, on the one hand, this is unprecedented, right? Like a closure of so many schools. And I think the closest thing you can think about are things of like natural or man-made disasters like Katrina in New Orleans, for example. But still, there were the trauma, not putting aside the trauma that was involved there were existing school systems where students could go if they relocated to Houston, right? Or somewhere else. There's nowhere to go. Everybody shut down, right? So in some ways there's a leveling, but that leveling is on to your point, already deeply inequitable and uneven ground. And that's been created by hundreds of years of racism, white supremacy, of inequities that have happened on an interpersonal and structural level that are still here with us in the city today. You know, it's interesting to be part of systems. I work in a state university, and I'm on the Board of Education that are perpetuators of institutional racism, and trying to come to terms with what it means to sit in those seats and be in those spaces, I think is something that all of us need to be asking ourselves. But to your question, sort of more specifically, I mean, when you look at maps of the city of Chicago, you can look at the same map and it can tell you about all types of different things, right? You'll see a heat map that'll be about where schools have been closed in the last several decades. Where health clinics have been closed, mental health clinics have been closed, where food deserts exist, where the mortality rate is lower, and they're all the same map. So I think there's something of a tragic sameness to it that can be very disheartening, right? But I think that it is the fact that this is like, we need to understand that this has taken a long time to build to this point, but that doesn't mean that we don't have a responsibility to work against it. To your very first point, imagine and demand alternative futures to the one in which we're living. And so things like disinvestment, right? Straight up economic disinvestment in communities, particularly Black communities in the city, for many, many years, selective reinvestment. And I've stopped using, I've said this in other contexts, but stopped talking about disinvested communities, because there are investments being made. They're just not necessarily in the things we want. So they're not investments in high quality access to produce or, new health facilities. Their investments in policing, or their investments in cash loans and these types of things. So I think that taking all of that into consideration sets the table for the fact that while there's a certain similarity between the fact that all over the country folks are not in school right now in the way they have been historically, we did not start at the same place, right? And so our responses to that have to be in a different measure and at a different scale.
Thank you so much for that. A couple of minutes ago, Dr. Sweeney brought up a phrase that I've been hearing a lot, and that I know folks watching will have been hearing a lot. It's always interesting to me when a phrase lives in academia world and then it crosses over, like gets on American Idol and suddenly becomes famous. And this month, that phrase is digital divide. And whenever that happens, it's always important to critically interrogate, what does the phrase really mean? What are we really talking about? So this question is for anybody. If you could explain to folks, what is the digital divide? What do we mean by that? How should we be thinking about that beyond maybe just getting computers to students? And yeah, I would just love to, and how can we fight it? How can we combat it? Would love to hear anybody chime in on that.
Go.
Again, just something real quick. This has always been a term, and actually, Eve, to your point, there was a crossover in the early 2000s around this. So you had a larger conversation, and there were people who were actually starting to engage in this language of the digital divide. And they were trying to do stuff at the K-12 level. And ironically, this is when Bill and Melinda Gates first started doing educational work. So when we talk about this digital, and I think in that framing, it has always been around who has access to actual digital infrastructure, right? But I think even that doesn't get to the point, right? So Dr. Breland actually put us on to really think about, what does it mean for communities to have certain negative investments and to historically be disenfranchised from others, right? So when we talk about something like the digital divide, we're talking about how people have structurally been locked out of systems of access. So this thing around, so many of us can remember, some of us remember the schoolhouses where there was one computer in a classroom, or you had to walk down to a computer center that the whole schoolhouse had to use, right? And then you go to a school in the burbs and everybody got a tablet, a laptop, a computer lab, and spaces where you could go rent computers or what have you. So this thing around, when we look at the ways in which race and class play themselves out in relationship to access, this divide actually widens. And I think another point to your question, and I think this is important to think about when we talk about CPS, Chicago Public Schools. Before the advent of COVID-19, 60% of young people in CPS accessed anything electronically via their phone, right? And I think that's important to put into context, right? So when we have that type of relationship, this divide is actually something that is more structural than something that is actually discussed as some new advent, right? It's not new, right? It's just the terms and conditions have shifted, but the same communities continue to be isolated.
Yeah, just to piggyback on that, I remember when I started teaching in 2001, and we had gotten like 3 or 4 computers in the classroom, and then there was a computer lab, and then maybe about 5 years later, I moved right outside of New Orleans, and we started to figure out how to get computers into the hands of every student. And that was all interesting, but then we also had to grapple with some young people don't have access to technology at home, and access to technology is access to learning, it's access to healthcare. It helps you to find where the services you can have or that you deserve. And then also finding that even when you check the location of the services you need, they were very far away, right? So the digital divide in my mind, to Dr. Stovall's point, is this sort of interconnected way of getting what you need and what you deserve, and to his point about being locked out of the system. So one of the earlier ways to sort of disrupt that is to start to put devices into the hands of young people. We've also given out mobile hotspots. But then there is a point at which it's like, if we can do all these things now, why are these not done for everyone? And how do we sort of like take capitalism out of this and recognize access to technology is access to the world, access to buying a cheaper flight. Like all of these sort of things that are very, very helpful is what's coming up for me when I think of the digital divide. And how do we do systemic investments in schools, in communities, in local libraries, in homes? Like, could we set up a sort of larger infrastructure in a certain neighborhood where people have free access? Like really starting to reimagine and disrupt the way in which we've been doing this for a very long time.
Mm-hmm. Maurice, could you give us a quick update on how things are going with Chicago Public Schools and providing access to devices to young people? Where are we with that? And also, I would love to hear from others. This is an unapologetically leading question, but what about beyond the devices, right? Is providing the devices enough? I would love to hear folks chime in about what happens next. But first, we'd just love to hear that update about where we are.
Yeah, I'll give an update, and no, just giving out devices is not enough for me. But I think so we've given out at least 12,000 mobile hotspots to students who are in temporary living situations or doubled up homes. Schools are continuously giving out computers. I think we ordered another 25,000, we received those. So as we order something, we give them out, and we've been encouraging families to connect with the FACE Office of Family and Community Engagement, or call the school, or call 773-553-KIDS to let us know, if you still haven't gotten what you needed. So that way we're constantly responding to whatever.
Say that number again. That number one more time is, there we go.
773-553-KIDS. That's the number to call. And that's so that people can get their individual needs responded to. Some of the responses are like, hey, meet the principal at the school, right? There's some quick ways I think we can solve some of these things while also thinking about systemically, how do we address them?
Great, and we'd love to hear folks chime in. What about after you get the device? What happens? What do we do?
Can I say one more thing about digital divide? I mean, I think it's related to this, but I guess I just wanted to stress, when we talk about access, so there's the device itself, then clearly if you don't have internet access at home, what exactly are you, or you can do things on your computer, but who are you sending it to and how, right? And if you're hotspotting off your relative's phone, but it doesn't have enough bandwidth, access to internet is a major hurdle. And I think one of the things that is so frustrating right now is that school systems are not structured to be internet service providers, right? We have a system in which we have corporations who are internet service providers who are not providing internet access. And so, I mean, I think the long-term question we need to be asking is how to make internet a public utility in the way that and freely accessible in the way that television used to be or still is, and telephone service at some point, and the radio at various times in our history as important and essential modes of access for democracy, but also just for day-to-day information and to be an informed citizenry. So I think that's the larger sort of scope of this. In the short term, though, I just want to put out there that like folks have been hustling to try to get this internet. And I don't want there to be a perception that like people are just like, oh, there's no internet. Like, I mean, I was on calls yesterday all day getting updates from people on, well, we're talking to these folks and we're talking to those folks. I was in a meeting last week trying to get philanthropy to get on board. But at the end of the day, while I so appreciate the philanthropic dollars that are coming in, this is a larger issue that needs to be addressed at a systemic level by our government. And again, bring me back to the point of the importance of the public sphere right now. This is a problem that is a problem of the public, and I think needs to be addressed at that level and for that audience. And I think it's very frustrating now not to be able to say, Comcast, AT&T, provide all our families internet, and then just do it, right? And I don't want to, that demand is being made, right? But I think the frustration of that, the response not being like, yeah, sure, absolutely. And again, to the points already made, not just for our young people, but for everybody, right? If you want to get a job right now, what does that look like? You need to apply somewhere. You're not going in person to apply for something, right? So I think that, of course, our conversation here is about schools and education. It is so essential for learning to continue right now, for educators and parents and students to be able to communicate via the internet. But beyond that, our communities need access to this as a public service as well.
And Eve, just something real quick. the Center for Community Technology and Dr. Pione Zayas, we actually had some interaction with them in the early 2000s. So to everyone's point, there's actually the infrastructure currently in Chicago to provide internet to everyone in the city, right? That infrastructure does not have to be built out. It exists. In fact, in the early 2000s, Chicago, New York City, and Portland all were in a larger effort to actually make the city Wi-Fi accessible top to bottom. The only city that followed through was Portland, ironically the whitest city in the country, right? So this thing around really putting this in context around, so these things that we think to be big are already there lying dormant. And I think that's important because the infrastructure is there, but we haven't been talking about activating that infrastructure. And I think that's an important conversation when we're talking about education in this current moment, is also activating that infrastructure, because we're talking about education, but when we talk about education, we also are bringing in what education is connected to, right? So education is a housing issue, it's a healthcare issue, it's a access issue. So all of these things become important when we start to bring that conversation together.
I was trying to think of where I was, and it was Portland when I got off the plane, and it was like PDX citywide or something, and I never had to worry about internet access through, as I spent a week in Portland traveling the city, learning about just the city itself. Like, I love to travel, and I thought, why, at the time I thought, why isn't everybody doing this? And to your point, if we have the infrastructure, this is where government, corporations, and institutions have to come together, or have certain people have to be pushed on making sure that it actually happens.
If I can just add about to the question with respect to, okay, once people get the devices, now what? And I'd like to just raise the issue of thinking about technology and devices in the context of early childhood. I'm a parent of 2 children, one in pre-K, one in first grade in Chicago public schools. And the remote learning has been incredibly challenging. And this is me as an educator, my husband's an educator, we're both working remotely. We're in an ideal situation. And I have to give it up to the teachers, because you can tell they're working incredibly hard. But I think that the whole framing of it all is completely misguided. And it was very obvious that everything was done in the context of emergency. And what I mean by that, to give you some practical examples, my children receive 8 lesson plans a week each. I have to corroborate every single lesson plan to figure out, when are they doing their virtual check-ins? When are they doing the Spanish literacy? When are they doing the dance? All of that. And then create a schedule, make sure we all have the devices okay, and assume, and then we have to sit there with them. Because when you think about young children, you can't just say, hey kid, do this assignment and I'm gonna check back with you. No, you have to do that. So in the same way that teachers have to prep to teach, parents have to do the same thing if you want to be effective, right? If you have that luxury to be effective. And then on top of it, children, particularly the younger ones, are not gonna get the most from a device. The way that they learn is in the context of actual human interaction and engagement. And you get a level of that with Zoom, but again, let's go back to a preschooler who's just excited to be touching a computer screen and changing all the different views, that, you know, that becomes the lesson versus the content. And then it becomes a frustrating experience. So all of those things need to kind of be thought through, not to mention our children with disabilities. How do you differentiate support in a developmentally appropriate way through a device? And how do you actually accomplish that? And I mean, we had the benefit, I experienced going through an IEP process during the pandemic. So I've been able to witness this whole thing from beginning to end and trying to figure out how to make it work under these contexts. And again, I preface all of that to say I'm in an ideal situation. I think about the majority of our families and how much more it will take to support the efforts. And that's why I think we shouldn't think of the devices as the silver bullet. They're just a tool in the toolkit. And we need to think deeper about how we expand that toolbox through the process and think outside of the box.
Yeah, it's so important that you said that, because to our earlier conversation about everything being interrelated, how are you as a worker, depending on your situation as a parent, how are you supported in your employment to be able to even do what you're describing, right? And what supports are we providing or not providing as a society to enable you to do that? I actually want to take us further in that conversation about students with disabilities. And again, for the non-ed wonks in the audience, IEP is an individualized education plan, which is a legally binding document outlining the accommodations and modifications owed to any student who is found to have a disability. So let's go in that direction. What does educational justice look like right now for students with disabilities who are not able to access the needed services that are supposed to be guaranteed to them? Would love anybody to chime in on that. Maybe we'll begin with you, Dr. Rideau, if you have any thoughts.
So first thing I will say, and I just want to put in a plug and bridge the digital divide conversation with this current conversation, because one of the things that the Chicago Teachers Union has done is that they have also actually partnered with a TV station, with Fox 32, on My 50, from 11 o'clock to 12 o'clock. They're providing programming for our young people, because we understand that some of them don't have access to a device, and also don't have access to internet. So CTU teachers are basically presenting on this platform of the television, because we know more students have access to that. So that is one thing that's actually being done. And there's a call out for our counselors, our social workers, also to be working within that space, also to be helping with our students with disabilities. And so one thing I want to just talk about as far as this context period, the previous speaker had already talked about the fact that we need human interaction, right? Like this does not take the place of schools and teacher-student interaction and teacher-student community interaction, right? We're just trying to hold on until we can once again be face-to-face. So part of our issue and part of the problem is that we have many of our young people with disabilities where talking through a screen strictly is not going to be just. They are not going to be getting the things that they need. Our young people who don't have visible disabilities, right, are not getting what they need just from these screens. And so we have to think about what is possible for us to do in this space while also keeping our young people and our teachers and our peer professionals and our communities physically safe, right? We know we have to social distance, and so we can't be in those close proximities. So again, we have to reimagine, what does this look like? How do we do the best we possibly can with making sure that we provide for those needs that have been already talked about in those students' individualized education plans? What kind of therapeutic services can we provide through a visual means? What are some ways in which we can educate and work with parents to do those kinds of things that maybe we can't do physically? So again, I'm gonna just talk more about sustainable community schools. We don't talk enough about the fact that schools have not been welcoming places for many of our young people. And that is not the case just now. That has been the case for decades. So that means that it's not just been not a welcoming space for our current young people, but for their parents and for their grandparents. And so there is this system that now is in place where we need those parents and those grandparents who have not had positive school experiences, right? So we have to go about the work of rebuilding and restoring some of those broken and damaged relationships. And that is the only way in this moment and moving forward, we're truly going to meet the needs of our young people, is if we have a focus and we center on making sure that we are trying to bridge that relationship. Because frankly, if I haven't had a positive experience in school, I'm not going to be asked to call up the principal or call up the school to say, hey, where do I get a device, right? And so we have to really center and prioritize, how do we rebuild, the trust between schools and, our community members, our parents and our grandparents, because there is a broken relationship and a damaged relationship there. And if we don't focus and prioritize that, then we're not, even if we have access, even if we have the money to provide all of these wonderful services for our young people, they're still not going to have access.
Thank you so much. Do others want to chime in? And perhaps Maurice, not to put you on the spot, or Elizabeth from the district and board perspective, or Christina from the state perspective, anybody, what do we need to be doing for students with disabilities right now?
I think the organization around responding to young people's needs in this situation is complex. When we think about providing services, we're actually talking about the teacher, the infrastructure for the teacher to have the right relationship and resources to support the student and the family on the other side of the screen. That has been a little bit complex in terms of scheduling and how do we make sure, especially with schools that have larger special education, diverse learner populations, or organized in a way in this digital space to support young people. We've been working on that as an organization. Dr. Stephanie Jones and her team has been helping schools to situate the time in which students get the services that they need. What I will say is that we're being responsive. It's pretty complex, but I think we're moving in the right direction in terms of how do you actually get an adult to work with a young person around their specialized needs with the time sensitivity that we can to make sure that young people are getting their needs met.
Yeah, I'd add to that. I think that, again, and this sort of comes back to my earlier point, I think communication is really critical right now, and particularly for our parents of diverse learners. I know there's been an effort that Maurice was mentioning from Dr. Stephanie Jones to have send out regular FAQs. And I also want to and show up at community groups that are working on this issue. So I know that she has a standing sort of communication with some of the advisory groups around issues for diverse learners, as well as Raise Your Hand and some of the other groups of parents who are organizing around supporting students with special needs. So I think continuing that active communication is so important right now, because of all the issues that have been brought up already about some of the real limitations given the fact that we cannot physically be in the same space, and that frankly that is some of what is required sometimes in order to be adequately meeting some of our diverse learners' needs. And so I think continuing to have that open communication and having parents feel like they have access to Dr. Jones and her team, but also to the staff in their schools, is something that's really important to continue to closely monitor right now and encourage.
And I'll say that there are a few of us at CPS, to Dr. Todd Breland's point, I'm in those same conversations with Raise Your Hand and other organizations. We met with MICFA Challenge and some student groups. We do our best to show up when we know people are organizing and meeting. And so maybe I should drop the CPS number again, 773-553-KIDS. Like if there are opportunities where people are organizing, raising their voices and their hands, and just to heighten issues for us, they should definitely let us know, because we've been really taking a participatory approach to how we respond. Some of these things are nuanced, and so it could be connecting with the principal and the school as a way of organizing. And then some of these could be more systemic that help us to actually mitigate these challenges long term, or at least while we're in this new sort of reality.
One of the things I've been advocating for at the board level is to think about how we can be judicious with our resources. Because we were in emergency mode and we put out the guidance for remote learning, when the stay-at-home order was put in place, I think we need to think about how do we leverage professional learning right now for educators. Because whether or not we stay in a remote capacity or we go back to a version of in-person, there's going to be a lot of additional layers that we need to address that will only enhance what we already knew we needed to do, and that is to build the capacity of educators to support the social emotional needs of young people, young children, the trauma-informed pedagogy, the healing-centered engagement. And so, and that extends obviously for our students with disabilities. Particularly, I think about those students who are used to a particular structure and how all of this dysregulates them. And so how can we think about, could teachers get subsequent endorsements and really get the resources to do just that? Could homeroom teachers work a lot more collaboratively with the special education teachers and the specials teachers to integrate lessons? I know that, you know, all individualized education plans are just that, they're individual, but how can we in some ways work smarter, but also attend to these really unique, deep needs that are particularly going to be rooted in the social emotional piece, which is the foundation for all academic acquisition.
I would also say,
oh, go ahead. Sorry.
no, and I was just going to say with that, communication is also going to be key in those efforts. You cannot have this be a top-down approach. So you cannot have folks who are in administrative positions, management positions, the board, Chicago Public Schools, making these decisions absent of the union, absent of practitioners who are actually going to be the ones who are on the ground doing this work.
Thank you for saying that, because everything that we thought we knew is now topsy-turvy. And so it's really imperative for there to be those channels for mutual learning and for feedback happening all the time. Let's talk about another particular student group that I think is often not discussed, and that is incarcerated young people. So it's really encouraging to see all the mobilization and conversation that's been happening around bringing the issue of COVID-19 for incarcerated adults to people's attention. But what does this mean for young people, and what does justice look like for that group of young people right now?
I think there's, and thank you so much for that question. I think this is really important at this current moment. And we hear oftentimes for folks in activist circles who actually do decarceration work, we hear the term free them all. And I think this is important when we talk about young folks, because 70% of the young folks who are in the Department of Juvenile Justice are there for nonviolent offenses. So if we look at that in one particular way, 70% of the young folks there aren't supposed to be there in the first place. And that other 30%, we haven't even engaged in the context in which got them there, right? So I think this is a really opportune moment to shift how we understand that. So one, in this kind of decarceration, really doing the work, and like folks were saying earlier, not just because a lot of times when people think about prison abolition, they think about just the gates opening and people just going wonton over every place. And that's not accurate. But I think what we have to begin to consider is what Dr. Rideau put forward. When we do something like decarceration, we have to understand that there are relationships in place. So we're not just releasing young people to their own devices, but we're being intentional about where they're going and the mechanism by which they are never to return. And I think this becomes important when we talk about something like decarceration, because when we start to think about all the elements that lead to the proximity of Black and Latinx students to the carceral state or being incarcerated, then we can begin to think about ways to keep them out. But I think at this current moment, especially when we're talking about at one time an airborne pathogen that it can be fatal to all groups, I think from this public health perspective, this is a prime opportunity to decarcerate, and to decarcerate with the understanding that the relationships cannot be severed in the decarceration. We have to be responsible to the folks that we are releasing. But I think this is the moment, we talk about these tiny windows. This is the moment to really think about what broad scale decarceration means, right? And then what does it mean to have folks in relationship once they are leaving a penal institution? But I think this is that moment to really begin to think about the possibilities and to engage them in real time.
I think this is also the moment for us to make sure, again, how we are reimagining the school system. The school system has been instrumental in our young incarcerated people being incarcerated. So we also have to reimagine when we do provide liberty, right, for these young folks, they should be going back into a sustainable community school space where the community is going to wrap their arms around these young folks, right? So we have to create a place of decriminalization of school. We have to decriminalize poverty. We don't want our students to go back into spaces where, again, they will be criminalized for their contacts, right? For the situation that they have been born into. And so part of how we do that, again, is reimagining what schools look like. With sustainable community schools, one of the pillars is positive discipline, right? Really emphasizing restorative justice and trauma-informed pedagogy, understanding that trauma itself should not lead to more trauma, right? And that is what we have done for centuries. And so we have to not only think about just our incarcerated folks and the institution of incarceration, but all of the elements that lead them to that space, schools being one of them. We have to completely reimagine what that space looks like.
I think what I also add to that is at some point, people's records have to be expunged. That's real healing when I know that this won't come back up to hurt me or to harm me later on. When I think about my former students at Tilden who would in some ways frequent the criminal justice system for really, I would say, petty reasons like that, and that when I think of people being criminalized and other people kind of getting a slap on the hand and told to go home, those things sort of like they nagged at me, because what I was finding was when young people will come back to the school, what does learning, what does healing look like? But I also started to run into what does housing look like? What does healthcare look like? What does transportation look like? What does employment look like? And so if I could add a layer to the community schools work, is like, what is the system that we co-construct with them that invites them back into the society and also sets them up to transform it so that situations don't happen generationally again. And I've been thinking, I said if there could ever be a project I started would be called Equity Heights, and playing off of the EH around employment, economics, expungement, housing, healthcare. If we could master the art of having a system to take that 70% that Dr. Stovall talked about, and even the other 30, to bring them back and to set them up, and also train everybody else to reimagine how they see Black and brown people, right? So like, if we could really do that, then I think we could set ourselves up for to decriminalize all the things that we're criminalized now. I mean, people are now making money off of marijuana, off of the thing that people were put in jail for, right? Like capitalism at its finest. And so how do we look at all of those records, expunge them all, and set people up to partake in where that money is going and how it should be used to support the people who are incarcerated because of it?
Thank you all so much for that. Go ahead, Elizabeth.
Sorry, I was just going to say, I think it's been really interesting to see the two things happening. On the one hand, I think a larger platform for this long-standing abolition work that folks have been doing for years get a bill, particularly in folks who are trying to get the elderly incarcerated folks freed immediately, as well as people who are near end of sentence, or in addition to those who are just saying free everybody, right? But like these specific populations, given the nature of the current health crisis. And I think it's also been really powerful framing around this idea of, being incarcerated shouldn't be a death sentence for those who are not sentenced to death. And it is right now, right? And I think that while that is an extreme sort of end of the road of that argument, we can look at the idea of incarceration as an intentional act of social death, whether it actually is as one experiences it or not. There's an intent behind that of some form of social death, of civic death, both while you're there and after you leave, and being disfranchised and not having access to all the opportunities that folks are talking about. So I think right now, when I think of the place that I see the government failing the most, that's one of the places I'm looking to in terms of the lack of action taken to folks who are incarcerated right now. And the fact that we need to understand how many families this impacts, right? So many of us have family members who are incarcerated right now, and that the weight, in addition to all of the other things that are happening, of that, I think is just really immense, or I feel that immensely right now. And then I'd say on the youth side, not so much for our currently incarcerated youth, but sort of more generally to that larger population who rotate in and out and who end up in our school buildings frequently, in our out of detention center schooling facilities. I think that we need to, again, expand on the services that we're providing for them. Last summer, I had an opportunity to visit the Summer for Change program that they put in place, which included for some of our both criminal justice involved young people in our schools, but also those in option schools, those who had dropped out or came back. So a lot of our most vulnerable young people who had access to things that we know they should have all the time, right? Mental health services, really deep therapy sessions, access to the arts, critical thinking and activities and projects, and they were paid for it, right? Because that's the other part of this that I think other folks have been lifting up. So much of this criminal enterprise are, as Monique said, criminalizing poverty, right? And so if we don't think about the programs that need to be put in place to address those needs, and I lift up Summer for Change as one example, but I think growing those types of programs, not just now, but on the other side, or I don't know if there is an other side, but moving forward, let's put it that way. I think that needs to be another area of emphasis.
Well, several of you have brought up social emotional needs and how crucial that is. And I wonder if we could talk a little bit about grief and about mourning and loss, and what it looks like to support young people as they are experiencing this grief, whether it's grieving the loss of a family member who may have gotten sick and fallen ill, which we know is disproportionately impacting Black, Latina communities, but also the grief at the loss of rituals, loss of friendships, loss of milestones. What can we as educators and parents who are educators come together, and how can we support our young people through this time?
I think there's a couple of things that I've seen across the country and here in Chicago that have been really encouraging. And I think one of the things is compiling those resources for family members who are experiencing loss, but also for the people that we are in relationship with, to maintain a series of check-ins with folks, right? Because a lot of times, one of the things that promotes grief is the distance from people, right? The distance from being in community with folks. So although we're limited in many cases by way of our digital situations or by social distancing, there are these ways in which we can still be in community with folks. This being one format, I've seen folks actually gather in spaces, giving themselves space to be in contact with each other. I think that's that supports specifically for young people, to let them know that they're not by themselves, and this is something that is happening to everyone, and that we're not going to get through this without them, right? That we are all in this situation, we're all dealing with it. And actually, to your point, to actually demonstrate some vulnerability by us as older folks and saying, I'm feeling it too. Right, I think a lot of times for young folks to see that they're not by themselves, one of the ways to see that they're not by themselves is to have that affirmed by somebody who's outside of their group, right? Because now them building community, because I think this is important, because when you got a mayor driving around yelling at Black and brown babies to go in the house, we're not taking into account those young people, just like Monique said, has been ostracized by these systems, right? And what they're really trying to do in ways that may not be the healthiest, but they're trying to preserve community with each other, right? And a lot of times we break that up and we don't understand that as such. And again, if we have the conversation with young folks about the potential dangers and not admonishing them for building community, I think we can do a little more, because that's a concern of mine, right? You know, cops rolling up on young folks, guns drawn, telling folks to get in the house. What's safe about that, right? And what about that is still pro forma for what they already experienced pre-COVID, right? So I think this thing around really encouraging our own vulnerability, but also utilizing the myriad of ways that we can be in community with each other. And I think that's really important at this particular moment. And I really think about the little ones in terms of the ways in which they're understanding this new world, in terms of what's at their disposal and what can be done.
Did others want to chime in on that, and what SEL, what social and emotional learning and support looks like right now?
So I was an 8th grade teacher. So I always get, since I left the classroom in 2017, I always get a little nostalgic around this time anyway, just because I would be planning and getting ribbon pinnings and luncheons together and all of those kind of just wonderful celebratory moments. And so I've reached out to some of my young people that I've had relationship with. And what I've always tried to tell them and to instill in them is that, you know, our love for you transcends these buildings, right? We kind of have this system where once our students leave school, it's like, okay, they're gone. And so in this moment, again, we need to also transform what that looks like, to talk about, like, you are still a part of my community, whether you are still here in this proximity, whether I can only see you virtually, whether you're across the country in college, where you should always be able to come home. And what home is just that community of folks who have helped to raise you to this point. And so I've reached out specifically, you know, to young people just to ask how they're feeling in this particular moment, to talk about, especially our 8th graders and our seniors, to just really talk to them about how we're proud of them. And this does not take away from all that they have accomplished. And also to really let them know that we will be there to support them in this next stage of life, because this is really going to be difficult, that we have, you know, 8th graders who are now going into a completely different space when in-person does come. You know, they're going into a completely different space, into a high school. And so how can we do certain things to make sure that we're supporting them, and also our seniors who are going to be literally leaving their school buildings to go on to post-secondary or whatever they're going on to. So some things that I've seen some people also doing, some community organizations, is that for seniors, for example, they have seniors who have left and have come back from college, doing a virtual workshop, talking to them about what the college experience is like, talking to other people, and just helping and supporting them in that way, so that they don't feel like, you know, I have no idea now what this is going to look like when, you know, in-person instruction or whatever returns, but to help them and support them in this moment for their next, where they're going to fall next in life. So those are just some of the things that I've been personally trying to do, but I think it'll be really important for our ones who are not going to return to the same school buildings, for us to show our support of them.
Yeah. I guess I'll start by talking about, so I've taught remotely through this as well, clearly at the college level, which is a different experience, but I think it's been an interesting, a different type of relationship with my students. And of course, we've talked about the limitations of the digital interface, but I will say, like, via email, sometimes through phone calls, I've had far more in-depth relationships with my college students than I ever had before. And I think one of the things that was really important to me is, in all communications with them, to lead with, how are you? Let me just check in with you first. How are you feeling? Are you well? Do you need any of this menu of resources that we have here at the university to help support you, before it's like, and what's your project? Like, what's happening with your paper? So I think leading with that grace and that compassion and that empathy for students is really important. And I know that our CPS educators are doing that as well. And so again, as we've talked about the limitations with the virtual model, it means so much to kids to be able to just see and talk with their teachers, to see, you know, that face, to hear that voice, to know that they're there to check in with young people, and that's also happening over the phone, you know, for those who don't have internet access, and school communities really checking in on folks and trying to figure out what are their needs, how can we connect them with services that they need. I guess like in sort of the context of broader mental health services and such, the city has its own website, but on cps.edu/coronavirus, there's also a set of resources that have been put together by CPS specifically for mental health resources. But I think, again, it's our educators, it's our social workers, it's our folks in the buildings who already have those existing relationships, who are really doing amazing work right now to continue to support that learning. And that again, back to some of, I think, Christina's earlier point, that learning it starts with what, right? It starts here with that social and emotional and builds upon that. And so I really am grateful to all of the educators who are out there trying to make those connections in really difficult times.
If I can throw in a couple early childhood pieces around this, that I just got through putting together actually a webinar for emergency childcare providers in terms of how they can support the social emotional needs of children. And actually our first piece of advice, and it is based in the research, is self-care. Children are, and young people too, are very attuned to how the adults around them are processing and feeling what's happening. And it's not to say, I mean, to, Dr. Stovall's point, is not to say like we shouldn't fake the funk, right? If we're in our feelings, we should demonstrate that we're in our feelings, but we should also share when we're progressing and we're able to move beyond some of those deeper feelings. And so that's where the modeling comes in. But with young children, it's really important to affirm those feelings, to provide them with a language around feelings so that they are able to articulate and communicate their needs, and also to promote and praise when you do see children being able to work through what they're feeling. So all of those things, even though it was very much focused on early childhood, I think it definitely can span the whole human development spectrum. And a resource I would like to share, Erickson Institute has a Center for Children and Families, and we are providing free bilingual Spanish-English virtual behavioral and mental health therapeutic interventions. I will share the intake numbers with the group so that we can pass that information along. But emotional well-being and health begins in the early years, and I think the more that we can support and wrap around that, the better our children will be able to process this brave new world. And so those are some of the things that I've been thinking a lot about lately too, and how it does span the whole spectrum, and it starts with us. And then of course, Audre Lorde said self-care is an act of political resistance. And that's what this work is about, self-preservation for the community.
I'll just add two things. As a former principal, I think it's so important for the adults to attend to themselves in their own community as a way of wellness. Like I heard this quote that every good therapist has a therapist, that it's important for people who are, whose jobs to support other people are also getting the support that they need. So we've started all of our team meetings, whether we're meeting with other groups, to say, to Elizabeth's point, like, how are you? How are you doing? And also to acknowledge people when we go to the store anywhere. Like, I appreciate you for showing up to work today because you're helping me to get my needs met within my own home. And so thinking about all of those, I think a part of what's coming up for me is like my own sort of self-awareness and how I engage the people who I am walking past every day. Like if I'm wearing a mask, it's harder for them to see me smile, right? So I might wave and say hello. And I think there are ways in which we can affirm each other and our young people. And schools have behavioral health teams. So like when Monique talked about sustainable community schools, a part of that model is to have a behavioral health team or an organized group of people within the school just to have a system of supports for young people. And so to keep those systems in mind. And I think it's also just a plug to like send people emails and just say something, because sometimes those things just are very helpful in our everyday human interactions.
Can I just chime in one more thing, is that all the things that we are saying now is wonderful, and we can't have this atmosphere of compassion and care And then when school starts back, say, okay, we're going back to business as usual. So everything that we are talking about now should be the way that our schools function and operate. And I don't want us to lose that in the moment of trying to return to normalcy, because normal didn't work for most of our young people, for most of our communities. We were never in a good place, right, since we've been here. So this is an opportunity for us to, again, reimagine and demand that the care, the flexibility, the empathy that is being pushed now in this moment needs to continue whenever we are also able to be face-to-face. And that's how we need to move forward from here on out.
Amen, amen to that. So thank you all again for this wonderful conversation, and thank you to everybody that is at home watching, and thank you to the people who submitted questions online. I'm just going to ask a few more questions just to give you all a heads up about where we are in the conversation. I want to pick up actually right where Dr. Rideau just left us and thinking about compassion, because Dr. Rideau, you began our conversation today by talking about quality teaching and how part of that is integral. You know, that's an integral demand, is to demand quality teaching. And I think a lot of educators who might be watching this in Chicago and across the country are struggling between trying to maintain what we think of as quality teaching, quality instruction, not cheating our students out of learning. Many of our students, I know at the university level, are feeling like, you know, they're like, I want a refund because I'm getting half a class. This is not what I came here for. How do we balance that quality teaching with having the compassion for everything that students are going through and coping with anxiety and uncertainty? I would love to hear from the group how you all understand that balance, because I think it's something many teachers are struggling with.
Yeah, in terms of this particular moment, if there's this thing, and I always think about it not even as a balance, but a harmony, right? So in harmony, it's not that everything is equal, but it's that you have to give some things in some ways, you have to adjust things in another way. So it's always around building this harmony between what it is that you're doing. And I think one of the things around really being honest with young folks and our students around, this isn't the best way to communicate, you know, the content that we're trying to engage. It's not the best, but it's what we have right now. And it's what we have right now because the main thing is that I want you to be healthy and safe, right? And I think, and that's a thing that always rings loud to me, is to have that upfront conversation with folks. And now here's what we can do. And if they're really open, I think when we talk about compassion, when we talk about actually doing work with quality and integrity, now what are the ways? So as Elizabeth talked about, what does it mean to open up and now say, if there are other concerns that you have, here's where we go. Or if there are needs, or if there's different questions that you may have, here's an opportunity to engage that. Now, having high schoolers and older folks as college students is a little different, because the chat box has become this entirely different place, right? And I'm so technologically inadept or so far behind, I don't even know if the chat box is the right name, right? But whatever happens in that chat now becomes a way for those who wouldn't speak up in class to now ask you very detailed questions, right? So we have to use what we have, but I think also having that honest conversation and saying that, no, this isn't the best space. And I need you all, if I'm talking to my students, I need you all to keep me accountable in the ways that you would need, be clear in articulating and be very committed, because that's the thing that we need to make the best out of this. So I need to be responsive to your needs. I think that initial conversation becomes important around doing our work with integrity, because like you said, it's not the best situation at the current moment, but it's what we have, given the fact that, you know, and the thing that I'm always thinking about is, you know, when we talk about COVID, a lot of people can be asymptomatic, right? So this thing around, even if we wanted to rebel and get into space with each other, we still could be harming each other, right? So this thing around thinking about that in real ways, because, you know, I don't know where my other comrades are on this, because man, I have been in rebellion mode. I'm like ready to rip off the face mask and just run to the homies and be like, look, we out here, we are outside, we're just gonna be here, and then what happens, you know, it happens. But again, that's not, fatalism isn't a good tactic to have at these times. So, but I think around really engaging that and being honest about, this isn't the best, but here's what we can do given what we have.
If I can just add on to that, I'd like to offer that what we are experiencing is rigorous. It is challenging. And, you know, I go back to from brain science, right? The part of the brain that registers stress and trauma is also the same part of the brain that registers memory and comprehension. So the stress that we experience is literally getting under our skin, forming muscle memory. And for us to manage that, and for us to work on self-regulation and self-soothing practices and self-care and pro-social behavior and managing all of that, that is very rigorous work. And that can also have not only the indirect academic outcomes, positive outcomes, it can also create a sense of very in-depth awareness of young people in terms of how to make sense and process all of this. And so I know that we get nervous about the learning loss, but there's a lot of learning going on. My preschooler knows the evolution of a virus, understands that distribution of goods is a political commodity and decision making. Like, that is invaluable learning that is happening that's not coming out of the lesson plans I'm getting. And it's no disrespect to the lesson plans, but there's so much that young people are getting right now that we could thoroughly leverage and we need to acknowledge. And so again, it makes me nervous with the learning loss conversation and how that stirs up this crisis, and it kind of gets back to that whole disaster capitalism piece. So I just want to raise that.
So because building curriculum is the love of my life, curriculum for me is therapy. It is social emotional learning. It is trauma informed pedagogy, right? Culturally, critical cultural pedagogy is all of those things. And it's also academically rigorous. As a matter of fact, it can't even be considered culturally relevant if we're not talking about building socio-political consciousness, right? So what is absolutely happening right now is curriculum, and we as educators need to be using that in community wisdom, right, as Christina just talked about, and putting those together to co-create curriculum in this moment and also moving forward, right? There is a vast amount of community knowledge that we could be using. I had a conversation with young people after the Facebook, post went viral about the folks on the West Side having a party and all of those particular things. And we had an in-depth conversation about COVID-19, how young people, young Black people particularly, have been portrayed, how they've been portrayed historically, how they're being reacted to now, and how that relates to how they've been reacted to historically. And they talked it was an amazing conversation how they talked about people are saying, are coming to us and saying, well, hey, do you want to get your mama sick or your grandmother? And of course, no, we don't. But we also don't know if we're going to be here tomorrow, not because of COVID-19, but just period. We don't know if we're making it to 21, right? And so we interrogated that. What has created that kind of perspective for our young folks? Right. And so that's a conversation that we can build curriculum around. And so we have to use our students' lived experiences, the experiences of what's happening in community to engage them right now. Because again, it's not going to be standardized tests, because they're like, oh, we don't have to do standardized tests. So you can't give me a grade. So you're not going to engage me in that way. So how else are we going to engage our young people? We have to use their experiences, what's happening in their lived reality, and show them that, guess what? We can use these mathematical, these science, these reading skills to read and write a new world, to imagine something different that works for you and your community. And so that is what curricula in schools needs to be about. And we have an opportunity right now, because we are not tied down to teacher evaluations that are based on student growth scores on standardized tests. We have an opportunity to do some real teaching and learning in this moment.
Yeah, I was just gonna thank you for that. Thank you. I feel like those back to back, I got some words right there for like this psychological perspective, and now like curriculum is my life. I love it. I know for me, and I've been thinking about this in my own teaching. I mean, I had to change my course, right? 2/3 of the way through the course. And so the last half of the course, we ended up, so I was teaching a history course on the history of Chicago, and our final assignment, instead of having a traditional final exam, they had to create their own primary sources. And so they're creating their own sources about this moment, their reflections on what it means to live through this moment. It could be journal entries. Some people produce incredible artistic reflections on living in this moment, and we have the opportunity to archive them. But to your point, I mean, it feels like, I do think there's a danger in imagining what's happening right now strictly through a lens of deficit, right? Young people are learning so much through living through this moment, and building on that as a basis and grounds of all types of different growth is something that I think we really need to be taking advantage of. And just one more thing, Dave's point earlier about the chat, it's so interesting to see these sort of new intertextual ways that people are communicating, and these new forms of pedagogy through the screen. But I do also want to go back to that point. I'm very concerned right now about reifying in our moment the benefits of online learning. Like, I have very deep concerns about that, at the same time that today's initial point, it is what we have right now and we're using it, but it is not better than being in community with our people. And that may not be able to happen soon, right? So using this as we can and learning new things from it that I think are really exciting and opportunities, without saying that, oh, this is a better way, or this should go on indefinitely.
I had an opportunity to talk with some former high school students who, I can't remember if this was Texas or California, but they helped to design a high school course that they also co-taught with the teacher around issues that were important to them. And so to reimagine what education can look like, a part of this is like, there are some basic developmental needs around literacy, right? Like, how do we make sure that young people have the right reading experiences so that they can read well and write well when they become adults? The other piece of that is, how do we invite and involve young people in their own experience? And how do we actually get them to capture their experiences now to help us to better inform what we create in terms of curricula across any school? And there's also a point of like, young people, especially those who have been disenfranchised or marginalized by systems, have always shown a degree of resilience, even through crises, right? Like, for us, many of us middle-class folk, this is sort of hitting at us, but young people, like, I've always been struggling with different conditions, and people haven't been here to support. And so like something Monique said earlier, like, how do we sort of just stop all of that from happening and making sure that we're totally responsive? And I do think as an organization, we're getting better at and continuously thinking about, how do we invite and involve people who are living these experiences into the decision-making space? And I think as an organization, we have definitely been open to that. We've been pushing ourselves with the school funding working group. There'll be a capital, some vertical meetings coming up soon. The ARA is coming up soon, so that we get closer to the people who we serve, and also recognize each other as neighbors, and not like, that's the community and this is the organization. But we're actually talking about the people who work and live down the street from us, and how do we take a human-centered approach in all of this?
Thank you all.
Call out one super quick thing, Eve, super quick. I just want to note, and I know that this was not like by intent, but that there aren't any young people on in this conversation, and that listening to young people right now is so important. And so I will make a pitch for any high school student who is interested in becoming the new student member of the Board of Education to please apply for that opportunity. One of the things that's been great about being a board member, I get to hold a lot of office hours. And in the last couple of weeks, I've actually had quite a few office hours with students. And that's been so powerful and has just deeply informed the work that I'm doing right now. And so I think we need to be listening to students and allowing them greater and greater platforms to share their perspectives on our moment and their ideas for what co-creating what comes next looks like as well.
And we need to open that up to be more inclusive, because our middle school students also have very important things to say and things that they need to offer up. So
True.
Open that up.
Thank you. So we have just a real quick hot second left. And Elizabeth, that was your answer for my last question. So because my last question is, I want all of you all to give us some homework. We have began by talking about the ways in which there are possibilities right now to think radically about resource provision, to think radically about meals, computer access, to think about partnerships between educators and families. None of that happens unless we do stuff. So can you please give all of us some homework, some next steps that we can take today to cement these possibilities and make them into reality? So just a quick 30 seconds or less from everybody would be great.
Just something real quick, and it's been mentioned earlier, Raise Your Hand Illinois has a very substantive set of resources for parents. Also the Brave Space Alliance, which is some work that I think a lot of times gets ignored when we talk about our LGBTQA plus students in terms of the resources that are there for them. And then an organization on the Southwest side, Iman, has some resources for families who are dealing with everything from education, healthcare to employment. So I think those are spaces, and Iman is the Inner City Muslim Action Network. So those are spaces that are readily available that I think folks should be checking out at the current moment.
From the federal and state level, I'm paying attention to the CARES dollars. You know, we only got $31 billion in terms of the $1 trillion budget that they put together. It's not good, it's bad. It needs to be 10 times more. There are groups like Advance Illinois and some other people who are paying attention to and putting pressure on senators and Congress around giving us additional funding. And we know every district across the country is going to take some sort of hit. And unfortunately, we cannot allow the hit to be on the backs of Black and brown children. And so we need to demand more from federal, state, and local government to make sure that young people, especially those historically underserved, have what they need to thrive.
Along with that, I would say with the CARES money, we're specifically asking, we need at least $75 billion for sustainable community schools. Any school district that has, or school building that has 70% of students are at least low income, that should be the school improvement plan. The school improvement plan should not be privatization or charters or vouchers. It should be investment in those spaces. And obviously, we need money in order to do that, in order to build those partnerships, because educators can't be the end all be all. Our paraprofessionals, our teachers, our social workers, they do amazing, amazing job, but they cannot do this alone. So we need to be able to partner with mental health facilities, with food pantries, with all of those different assets that we have in our communities, but we need money in order to do that, in order to keep those things up and running. So at least $75 billion for sustainable community schools. So whoever your elected leaders are, to continually put that on their plate, that they should be pushing that in their legislative spaces.
Christina, take us home, 30 seconds.
I think it's all about process. And Dr. Rideau had mentioned this a little bit earlier in terms of who's at the table, who sets the agenda, who gets to live with those decisions that are made. We need to create space, demand space at these tables, and be active so that we can make sure that we get what we know we are entitled to. We put money into this system, into this economy, therefore we are entitled our very fair share. I'd like to promote, I do a virtual town hall every single month before the Illinois State Board of Education meeting to crowdsource my questions. Please get involved with that, because it helps me stay accountable, but it also helps me push forward how people are experiencing the decisions we're making on the ground. So thank you.
I want to say thank you one more time to all of our amazing panelists, Marie Sweeney, Elizabeth Todd Breland, Monique Rideau, Dave Stovall, Christina Pasiona Zayas. Thank you so much. You all have your homework, your action steps if you're watching this, and don't forget to wash your hands and be careful. Thank you all so much.
Thank you.